Welcome back to the afternoon session where we're going to go through the individual presentations. I just want to remind you all, as was said this morning, please make sure your cell phones are off, and note that the doors will be locked and secured during a presentation, so nobody's allowed to go in or out during the presentation. And also, no videos or photography allowed. So with that, I'd like to proceed and introduce our first individual presentation presented by Angela Zhang from Monta Vista High School in Cupertino, California. And her project is entitled Design of Image-Guided Photothermal Controlled Drug-Releasing Multifunctional Nanosystem for the Treatment of Cancer Stem Cells. Angela.
Cancer stem cells are recently discovered subset of cancer cells that are identified for initiating and driving tumor growth, inducing metastasis, and possessing self-sustaining, self-renewing characteristics. Although many current cancer therapies such as chemotherapy and radiotherapy are effective at killing the bulk of tumor cells, they're ineffective at killing cancer stem cells. In fact, cancer stem cells are known to be resistant to many current cancer therapies, and instead they survive and regenerate new tumor growth weeks, months, or even years after treatment. Thus, targeting cancer stem cells would provide a novel and decisive way to eradicate cancer. However, many current cancer therapies do not specifically target cancer stem cells. The closest is a study done by Gupta et al., which revealed that out of a screen of 16,000 compounds, salinomycin, a polyethnyl iron 4, was the only compound that was able to markedly and selectively reduce the viability of cancer stem cells. In fact, it was found to be 100 times more effective at killing cancer stem cells than paclitaxel, a commonly used chemo drug. However, due to observed toxicity within humans after systematic administration, salinomycin has not been enthusiastically embraced as a new chemo drug. Thus, the objective of this project is to design a novel iron oxide gold dumbbell nanoparticle for the localized delivery of salinomycin through a controlled release manner. My nanoparticle will be composed of 3 characteristics. First, tumor targeting capabilities for localized treatment. Second, photothermal controlled drug release for personalized treatment. And third, multimodality imaging for real-time monitoring of treatment response. The first novel characteristic of my nanoparticle is its high tumor targeting capabilities, which will allow it to accumulate at the tumor site through 3 major ways. First, through a passive mechanism of enhanced permeability and retention, which yields higher concentrations of the nanoparticle in tumor tissue as compared to in healthy tissue. Second, through an active mechanism in which the iron oxide nanoparticle will be linked with a peptide that will specifically target and bind to biomarkers that are overexpressed on only cancer and cancer stem cells. And third, by applying an external magnetic force at the tumor site, it will be able to take advantage of the superparametric characteristics of the iron oxide nanoparticle. And thus, these 3 targeting methods allows for highly localized treatment that increases treatment efficacy while minimizing toxicity to non-malignant cells in order to improve patient quality of life during cancer treatment. The second novel characteristic of my nanoparticle is its photothermal controlled drug release. The gold nanoparticle is coated with a smart polymer that can undergo conformational changes upon changes in temperature. A near-infrared laser light aimed at the tumor site will emit a light with a wavelength that matches the absorption peak of the gold nanoparticle and allow for heating of the gold nanoparticle. Heating of the nanoparticle causes the smart polymer to collapse, shrink, and therefore squeeze out the drug at the tumor site. This allows for highly localized and personalized treatment. The third novel characteristic of my nanoparticle is its multimodality imaging. The iron oxide nanoparticle can act as a contrast agent for MRI imaging, while the gold nanoparticle can act as a contrast agent for photoacoustical and Raman imaging. The multimodality imaging allows for real-time monitoring of treatment response that is essential in creating and developing personalized medicine. And thus, my project is composed of 3 components. First, the synthesized and characterization of the nanoparticle. Second, the validation of the functionality in vitro. And third, the validation in vivo. To begin the synthesis of my nanoparticle, iron pentacarbonyl was decomposed on the surface of gold nanoparticles and oxidized in octadecene solvent and then heated to 300 degrees Celsius in the presence of oleic acid, resulting in the dumbbell shape seen here. The dumbbell shape was confirmed using transmission electron microscopy, which also revealed an average diameter of 8 nanometers for the gold nanoparticle and an average diameter of 16 nanometers for the iron oxide nanoparticle. Spectrometer results seen here revealed a surface plasmon resonance peak of 538 nanometers, a slight redshift of 13 nanometers as opposed to the gold nanoparticle alone. Next, I was able to validate the molecular imaging capabilities of my nanoparticle. MRI imaging taken at various concentrations revealed no significant difference in signal of iron oxide gold nanoparticles as compared to the control of iron oxide nanoparticles alone. Similarly, when the nanoparticles were injected subcutaneously into mice, they were able to be detected for photoacoustical imaging. These two experiments allowed me to conclude that the conjugation of the nanoparticle did not inhibit either nanoparticle's capability to act as a contrast agent for either MRI or photoacoustical imaging. In the next step of the synthesis, I coated the iron oxide nanoparticle with dopamine, which is amine, which can react with the carboxyl group on RGD peptides. RGD is a peptide that specifically targets and binds to integrin, a biomarker that is overexpressed on many cancer and cancer stem cells. This allows the nanoparticle to specifically accumulate at the tumor site while leaving normal cells relatively unharmed. To validate the binding potential of my nanoparticle, I performed an in vitro study using breast cancer stem cells. Cells incubated with IgG nanoparticles resulted in 128% increase in binding uptake as compared to cells incubated with control nanoparticles that were not linked with IgD. Similarly, Raman spectroscopy revealed a 400% increase in binding uptake of IgD nanoparticles incubated in integrin-positive cells as compared to the same nanoparticles incubated in integrin-negative cells. Furthermore, these in vitro data were confirmed in vivo using fluorescent imaging seen here, which revealed a 4:1 tumor-to-tissue ratio, as well as an accumulation at the tumor site from around 30 to 60 minutes. So these results firmly confirm the capability of my nanoparticle to both target and bind to cancer and cancer stem cells in vitro and in vivo. In the next step of the synthesis, the gold nanoparticle was coated with the smart polymer, copolymer, polyisopropyl acrylamide, coacrylamide through gold thiol bonding, as well as surfactant exchange between PVP and the smart polymer. The smart polymer has the lowest critical solution temperature of 39 degrees Celsius, which was controlled through controlling the ratio between the two monomers, isopropyl acrylamide and acrylamide. This means that at temperatures below 39 degrees Celsius, the polymer is in an expanded and hydrated state, and at temperatures above 39 degrees Celsius, it is in a dehydrated and shrunken state. The conformational changes of the smart polymer allowed me to load and release salinomycin. Thus, to load salinomycin was mixed with the smart polymer-coated nanoparticles and heated to 42 degrees Celsius in order to obtain the shrunken state of the polymer, and then subjected to cooling in an ice bath in order to trigger conformational change, which caused the smart polymer to expand and therefore encapsulate salinomycin. To confirm the conformational changes of the smart polymer, I performed a dynamic light scattering test, which revealed that only the smart polymer-coated nanoparticles and not the control nanoparticles coated with PVP was able to undergo reversible hydrodynamic diameter changes. The results revealed that temperatures below the results revealed that the diameter decreased at temperatures above 39 degrees Celsius, and the diameter increased at temperatures below 39 degrees Celsius, and that this was seen to be reversible as well. Next, I was able to evaluate the salinomycin release potential of the nanoparticle. In order to do that, I subjected the nanoparticle to heating at various temperatures seen here and found a significant increase in salinomycin release at temperatures 39, the LCST, and 42 degrees Celsius that were not seen at lower temperatures. And finally, I found that salinomycin release had a positive linear correlation with nanoparticle concentration, as well as the laser power density that were later used to optimize the laser treatment. So these results allowed me to confirm that first, my nanoparticle is capable of conformational changes, and second, it is capable of photothermal controlled drug release. In the next part of my project, I wanted to validate the capability of my nanoparticle to kill cancer stem cells in vitro, and thus I used the cancer stem cells line obtained from breast tumor masks that were sorted for CD44 positive and CD24 negative cells, biomarkers for cancer stem cells. The cells were then transfected with a GFP luciferase gene reporter construct for bioluminescent and fluorescent imaging. These techniques were utilized for the high sensitivity, as they are able to detect as few as 1 cells in vitro and 10 cells in vivo. The cells were then seeded in a 96-well plate and either treated with PBS nanoparticles or salmonizin-loaded nanoparticles. They were either then irradiated with a laser or they were not. Fluorescent imaging revealed a significant cell death in cells that were incubated with salmonizin-loaded nanoparticles that were then irradiated with a laser. This was confirmed using bioluminescent imaging and then quantified using an MTT assay, which revealed a 98% cell death in soundomycin-loaded nanoparticles that were then irradiated with a laser as compared to the reference of PBS or the control. So these results allowed me to confirm that my nanoparticle is capable of killing cancer stem cells in vitro. Thus, in the final portion of my project, I conducted an in vivo study to further validate the binding, targeting, and therapeutic efficacy of my nanoparticle. After palpable tumors were formed in mice from injection of cancer stem cells, they were split into 3 groups: injection with PBS, injection with nanoparticles, or injection with salmonicin-loaded nanoparticles. Half were then irradiated with a laser, and the other half were not. CCD photothermal images taken after laser irradiation revealed that first, the nanoparticle once again is capable of binding, but more importantly is capable of photothermal effect, as irradiation with a laser resulted in heating of the nanoparticle. In order to monitor the treatment efficacy, I performed a functional, morphological, and molecular examination of the tumor. Early response was detected using FDG PET imaging, which was able to monitor tumor metabolic activity 4 days after laser irradiation, and revealed a 58% decrease in tumor metabolic activity of mice injected with salmonicin-loaded nanoparticles that were then irradiated with a laser. No significant decreases were seen in the other conditions, allowing me to conclude that any decreases in the original group were not due to the nanoparticle or to the laser alone, but due to the combination of salmonicin-loaded nanoparticles that were then irradiated with a laser. Morphological examinations of the tumor revealed that by day 21, the tumor had reduced to 23% of its original size of mice injected with salmonicin-loaded nanoparticles that were then irradiated with a laser. And these results were confirmed using bioluminescent imaging seen here. So, to conclude, I created a novel new generation iron oxide gold nanoparticle that is capable of tumor targeting potential and photothermal controlled drug release in order to increase treatment efficacy and minimize toxicity to non-malignant cells, characteristics that are not seen in current cancer treatments, as well as multimodality imaging for monitoring of treatment response. This nanoparticle allows for a highly localized, controlled, and personalized approach to eradicating cancer and cancer stem cells, the cause of cancer, drug resistance, and cancer recurrence. I'd like to thank the following people for their help, as well as the College Board and Siemens Foundation for giving me this opportunity, as well as the judges for listening to my project. Thank you.